Year in, year out, people lose their lives to malaria. Today, April 25th, marks the World Malaria Day, and the theme for this year is Accelerating the Fight Against Malaria for a More Equitable World. This theme is in sync with this year's World Health Day theme, which is My Health, My Rights, which highlights the urgent need to address the inequalities in access to malaria prevention, detection, and treatment services. Let's look at some statistics provided by the World Health Organization. In 2022, there was an estimated 249 million malaria cases and 608,000 malaria deaths in 85 countries, as compared to the 233 million cases and 576,000 deaths in 2019. In 2022, the WHO African region accounts for 94% of malaria cases and 95% of malaria deaths. 4 African countries accounted for just over half of all malaria deaths worldwide, and they include Nigeria at 26.8%, Democratic Republic of Congo at 12.3%, Uganda at 5.1%, and Mozambique at 4.2%. Children under 5 years of age accounted for about 78% of all malaria deaths in the region, and each year, malaria in pregnancy is responsible for 20% of stillbirths, 11% of all newborn deaths in sub-Saharan Africa, and over 10,000 maternal deaths globally. Let's look at some interesting facts about malaria. Malaria is a serious and fatal disease caused specifically by the Plasmodium parasite, which is transmitted through the bites of an infected Anopheles mosquito. Malaria is not spread through casual contact, but by the bite of an infected mosquito or through blood transfusion and sharing of infected needles. Only female Anopheles mosquitoes can transmit malaria, and not all of them are infected with the parasite. There are malaria vaccines available, which are the RTS-SA-SO1 and the R21 Matrix M, and these vaccines can reduce the risk of severe malaria in children, but does not provide 100% complete protection. Just as we have the antimicrobial resistance, there is an emergence of anti-malarial drug-resistant malaria parasites, which seems to be a challenge in the fight against malaria. Malaria can be prevented and eliminated through a combination of vector control measures, early diagnosis and treatment, and community education. The World Health Organization, partnered with other notable organizations, have joined hands to fight against malaria. On this World Malaria Day, let's unite in our commitment to end malaria for good and create a more equitable world for all. Together, we can make a difference and take a stand against malaria. Happy World Malaria Day.